If you encounter a road collision, quickly check the injured child. Unless there is danger, treat them in the position you find them in. Do not remove the child unless absolutely necessary. Always assume that there is a neck injury in anyone who has been involved in a road traffic crash and support the head until help arrives. Do not attempt too much. Only attend to those things which can be life-threatening, such as major bleeding. Keep the injured child warm by applying any extra clothing or blankets that may be available. While waiting for the emergency services, provide constant reassurance to the child.
Put your hand.
If your child gets a cut or graze, do the following. Ensure your hands are clean. If the child's wound is dirty, clean it by rinsing it lightly under running water. Pat the wound dry using a gauze swab. If you don't have a sterile gauze, everyday items such as freshly laundered towels will do. Avoid directly touching the wound. Once the wound has been patted dry, apply a dressing. If there is a special risk of infection, such as human or animal bite, or a puncture by a dirty object, take your child to your doctor or accident and emergency department. Contact your doctor if you notice that the wound isn't healing, or you notice any redness, drainage of pus, warmth or swelling. If your child has severe bleeding, take the following action. Put on disposable gloves if available. Apply direct pressure over the wound with your fingers or palm. If your injured child is old enough, they may help you by placing direct pressure over the wound with their hand. If possible, use a sterile dressing. If this is not available, use a non-fluffy material such as a clean towel. If the wound is on a limb and you don't suspect a broken bone, raise the injured limb above the child's heart. This may help reduce blood loss. Secure the wound dressing with a bandage. If you don't have a bandage, you can improvise using common everyday items such as a scarf or t-shirt. Remember to secure the bandage firmly enough to maintain pressure, but not so tight that it restricts or stops circulation. If blankets or coats are available, cover the child. Remember, children become cold quickly. If further bleeding occurs, apply a second dressing over the first and secure in place. Dial 999 or 112 and ask for the ambulance service. Remember, the child will be frightened, so at all times provide constant reassurance. While waiting for the ambulance crew to arrive, do not allow the child to eat or drink. If your child suffers a minor burn or scald, do the following. Reassure your child. Cool the affected part by flooding it with cold water for at least 10 minutes. This will stop the burning and help relieve pain. If you don't have water readily available, you can use any cold harmless liquids such as milk. Burns can cause swelling to the affected area, so while cooling, remove any items such as rings, watches or any constricting material. Once the area has been cooled, cover the burn with a sterile dressing or clean non-fluffy material. Secure the dressing in position by lightly applying a bandage. If you are at all concerned about the severity of the burn, dial 999 or 112 and ask for the ambulance service, or take your child to the nearest accident and emergency department. Remember, do not break or burst any blisters. Do not apply adhesive dressing to the area. Do not put ointments or fats on the area. They are of no value and only further increase the risk of infection and damage. If you suspect that your child has accidentally swallowed a poison, do the following. If your child is conscious and is old enough to understand and talk to you, ask them what they have swallowed. Dial 999 or 112 and ask for the ambulance service. When talking to the ambulance service, give as much information as possible about the swallowed poison. This will provide important information which will assist staff in the accident and emergency department once the child reaches hospital. Look for evidence that might help you to identify the poison, such as an empty container. Give this to the ambulance crew when they arrive. While waiting for the ambulance, constantly reassure the child. Never make the child vomit. If the child's lips are burned by corrosive substances, give the child frequent sips of cold water to cool her lips.
555 286.
Okay, thank you. What address do you need the ambulance to?
10 Foxrock Road.
Okay.
Hoth.
10 Foxrock Road. Can you just confirm that for me, please?
10 Foxrock Road, Howth.
Okay, what's the problem there?
My child is taking tablets.
Okay, are you with him at the moment?
Yes, I am.
All right. What age is he?
He's 3.5.
Okay, is he conscious?
He is.
Is he breathing?
He is, yes.
Okay, and you said he is taking tablets. Was it accidental or intentional?
Accidental.
Okay, is he completely awake?
He is.
All right. Is he breathing normally?
He is.
Okay, and do you know what type of medication or tablets he took?
They look like they're paracetamol.
Okay, so it's a medication. When did he take it?
I'm not sure. It could have been maybe 5 minutes ago.
Okay, that's fine. I'm organising help for you now. You just stay on the line and I can tell you what to do next.
Please do.
Now, okay, help is on the way. Don't give him anything to eat or drink as it might make him sick or cause problems for the doctor.
Okay.
Just allow him to rest in the most comfortable position for himself and wait for the ambulance.
Right.
If you just could watch him very closely, and if he becomes less awake and vomits, just turn him on his side.
Okay.
Do you have any family pets in the house, like a dog
No.
or anything? No. Is the child on any medications for anything?
No.
No. Now, do you know the medication container that he took the tablets out of?
Yes.
You just give that to the paramedics when they arrive. That would be great.
Okay.
And if the child's condition should worsen in any way, will you call me back again on 999?
I will.
Can I take the child's name, please?
It's Killian.
Killian. That's fine. Now, can you just have somebody look out for the ambulance as well, please?
I will.
Okay, the ambulance is on the way to you.
Okay, thank
All right,
you.
bye-bye.
Bye.
If a baby is choking, you must act immediately to try to clear the obstruction. Do the following. First, turn the infant face down with the head lower than the body. Make sure that you support the head, jaw and neck. Using the heel of your other hand, give 5 blows between the infant's shoulders. Turn the infant onto its back while still supporting the neck and head. Place 2 fingers over the lower half of the infant's breastbone, below an imaginary line between the nipples. Give 5 chest thrusts. Keep doing 5 back blows and 5 chest thrusts until the object pops out and the infant begins to breathe again. If the infant becomes unresponsive, call for help and send someone to dial 999 or 112. If you suspect your child is choking, ask the child, "Are you choking? Can you breathe?" If the child cannot breathe, talk or cough, stand or kneel behind the child. Place the flat thumb side of your fist between the child's navel and breastbone. Be sure to keep well off the breastbone. Wrap your other hand around your fist and press upwards towards the stomach. Keep doing this until the object pops out and the child begins to breathe again. If the child becomes unresponsive, gently lower the child to the floor. Call for help and send someone to dial 999 or 112. You must begin CPR. If during CPR you see the object, remove it with your fingers, but do not place your fingers in the child's mouth if you cannot see the object. First, let's look at how to perform CPR for children between 1 and 8 years of age. In this example, the rescuer is alone with the child. Remember, you must only perform CPR on a child who is in cardiac arrest. First, check for responsiveness. If you get no response, shout for help. If someone is nearby, send that person to phone 999 or 112 for an ambulance. If you are alone, you must stay with the child. Next, open the airway by doing the head tilt chin lift. Place one hand on the child's forehead and tilt the head back gently. Lift the chin by placing 2 fingers on the bony part of the child's chin. Do not put your fingers on the child's neck. Be careful that you do not tilt the head back too far. Next, check to see if the child is breathing. While holding the airway open, place your ear next to the child's mouth and nose. Look for normal rise and fall of the chest. Listen and feel for normal breathing. Take no more than 10 seconds. If the child is not breathing or is gasping, give 2 rescue breaths. Keep the airway open and pinch the nose shut. Place your mouth completely over the child's mouth. Give rescue breaths lasting about 1 second each. Look for chest rise with each breath. If the chest does not rise, reopen the airway and try again. Remember, it is important to give 2 good breaths to make the chest rise. Next, start chest compressions. Keep the child's head tilted back and place the heel of your other hand on the lower half of the child's breastbone. Do not press on the very bottom of the breastbone. Keep your elbow straight and make sure your shoulder is directly over your hand. Give 30 compressions in a row. Compress the chest about 1/3 to 1/2 of the depth of the child's chest. Ensure that you allow the chest to come back to its normal place after each compression, but keep the heel of your hand on the chest. Press the chest at a rate of at least 100 compressions per minute. After every 30 compressions, give 2 rescue breaths. Complete this cycle of 30 compressions and 2 rescue breaths for 2 minutes. If you are alone now, go and dial 999 or 112. After phoning for help, begin CPR again. Let's look at how to perform CPR for infants. In this example, the rescuer is alone with the infant. Remember, you must only do CPR on an infant who is in cardiac arrest. First, check for responsiveness.
Help! Somebody help!
If you get no response, shout for help. If somebody is nearby, send that person to phone 999 or 112. Next, open the airway by doing the head tilt chin lift. Place one hand on the baby's forehead and tilt the head back gently. Lift the chin by placing 1 or 2 fingers on the bony part of the baby's chin. Do not put your fingers on the baby's neck. Be careful that you do not tilt the head back too far, as you may block the airway. Next, check to see if the infant is breathing. While holding the airway open, place your ear next to the infant's mouth and nose. Look for the normal rise and fall of the chest. Listen and feel for normal breathing. Take no more than 10 seconds. If the infant is not breathing or is gasping, give 2 rescue breaths. Keep the airway open. Place your mouth completely over the infant's mouth and nose. Give 2 rescue breaths, lasting 1 second each. Look for chest rise with each breath. If the chest does not rise, reopen the airway and try again. Remember, it is important to give 2 good breaths to make the chest rise. Next, start chest compressions. Keep the infant's head tilted back. Place 2 fingers of one hand on the centre of the infant's breastbone below an imaginary line between the infant's nipples. Do not press on the very bottom of the breastbone. Give 30 compressions in a row. Compress the chest about 1/3 to 1/2 of the depth of the child's chest. Ensure that you allow the chest to come back to its normal place after each compression, but keep fingers lightly on the chest. Press the chest at a rate of at least 100 compressions per minute. After every 30 compressions, give 2 rescue breaths. Complete this cycle of 30 compressions and 2 rescue breaths for about 2 minutes.
Hello, operator. I need the ambulance service.
Now dial 999 or 112 for help and begin CPR again. If the child is not injured, but is unconscious and breathing, place in the recovery position. Continually check that the airway remains open and the child is breathing while waiting for the ambulance.